Let's start by the first question. Base of dance developed from pro-atlas, first occipital sclerotome, first cervical sclerotome, or second cervical sclerotome? Yes, the answer is C, first cervical sclerotome. Base of dance, which is analog of the C1 body, developed from the first cervical sclerotome. When you look to this diagram, you see an schematic illustration of the embryology of the craniocervical junction. The base occiput, the tip of deltoid, and the ligament attached to it develop from the fourth occipital sclerotome. The odontoid process is formed from the caudal part of the fourth occipital and the cranial part of the first cervical sclerotome. The most inferior portion of the axis body is derived from the caudal part of the first cervical and the cranial part of the second spinal sclerotome. Let's transfer to the next question. Venous angle is an important landmark for aqueduct of Sylvius, foramen of Monro, trigone of lateral ventricle, or occipital horn of lateral ventricle. Yes. Venous angle is the U-shaped angle where the junction of the thalamostriate vein and the internal cerebral vein form. When you look to this diagram, you see the internal cerebral veins viewed from above after removal of the central portion of the corpus callosum. And this red dotted circle represents the junction between thalamostriate vein and internal cerebral vein, and this is called the venous angle. And this part close to it is the foramen of Monro. So the answer is B. When you look to this cadaver, you see the yellow dotted circle representing the foramen of Monro, and the venous angle is near to it. The next question. Tarsal tunnel syndrome involves the following nerve: anterotibial nerve, posterotibial nerve, common peroneal nerve, musculocutaneous nerve of leg. The answer is B, posterotibial nerve. When you look to this diagram, you see the tibial nerve passes under the medial malleolus to supply the sensation of the sole. It becomes entrapped under the flexor retinaculum, which may be thickened due to rheumatoid arthritis, tight shoes, or tight casts. Nerve conduction velocity is frequently challenging and uninformative in patients with tarsal tunnel syndrome, particularly in patients with underlying polyneuropathy. Next question. Part of ethmoid bone are crista galli, cribriform blade, superior nasal concha, middle nasal concha, inferior nasal concha. The answer is A to D, because inferior nasal concha is not a part from ethmoid bone. Hypothalamic nucleus associated with water balance are lateral nucleus, ventromedial nucleus, arcuate nucleus, or paraventricular nucleus. Yes, the answer is B, paraventricular nucleus. To remember, you can use this mnemonic. The paraventricular nucleus is near the ventricle. Para equals near, and the ventricle contains water, CSF. So this nucleus is responsible for water balance, so the answer is D. When you look to this diagram, you see the hypothalamic nuclei represented, and the paraventricular nucleus is this nucleus represented by the yellow circle. Next question. Structure associated with auditory system are inferior olivary nucleus, superior olivary nucleus, superior colliculus, lateral geniculate body, trapezoid body, or spiral ganglion. Yes, the answer is D and E, trapezoid body and spiral ganglion. When you look to this diagram, you can interpret that inferior olivary nucleus is not apart from the auditory system, it's the superior olivary nucleus. The superior colliculus and the lateral geniculate body are parts of the visual system, while trapezoid body and the spiral ganglion are parts from the auditory system. So the answer is D and E. Next question. About Miller-Gubler syndrome. It is a lesion in the midbrain, ipsilateral sixth nerve palsy, contralateral hemiparesis, contralateral nuclear seventh palsy, contralateral weakness of the facial muscle. Answer is C. Facial and abducens palsy and the contralateral hemiplegia due to lesion corticospinal tract. This results from a lesion in the base of bones, usually due to ischemic infarction and occasionally due to tumor. Next question. About branches of internal carotid artery: lingual artery, posterior communicating artery, ascending pharyngeal artery, middle meningeal artery, and middle cerebral artery. Yes, the answer is B and D. Posterior communicating and middle cerebral artery are branches from the internal carotid artery, while the other branches are from the external carotid artery. Branches of internal carotid artery are ophthalmic artery, anterior choroidal artery, posterior communicating artery, superior hypophyseal artery, meningiohypophyseal trunk, terminal branches, anterior cerebral artery, and the middle cerebral artery. Next question. Muscle supplied by radial nerve: triceps, brachioradialis, abductor pollicis longus, brachialis, posterior part of deltoid. Yes, the answer is from A to D. The deltoid muscle is supplied by axillary nerve. This nerve supplies the deltoid and the skin above it. When you look to this diagram, you see the axillary nerve. It reaches the deltoid through the quadrangular space, which is represented in this red square. So the nerve reaches the deltoid muscle and supplying it, and the skin above it. So this is the axillary nerve in the quadrangular space, and this is the deltoid muscle. So the answer is A to D. Next question. Lesion of temporal lobe produces Anton syndrome, Pallin syndrome, disconnection syndrome, object agnosia, complex partial seizure. Yes, the answer is D and E. When you look to this diagram, you see the fusiform gyrus. Object agnosia can result from lesion in the fusiform gyrus in the temporal lobe, while Anton and Pallin syndrome are related to occipital cortex lesion. Next question. About nuclear third nerve palsy: ipsilateral ptosis, ipsilateral medial rectus palsy, contralateral superior rectus palsy, ipsilateral intorted eye. So the answer is B, C, and D, while ipsilateral ptosis is not an answer. When you look to this diagram, you see the superior rectus and levator palpebrae superioris are bilaterally supplied.